is Ashuri, and thank you so much for joining me on my healthcare integrative therapy video for my signature assignment. So let's first go over a brief overview of the case. So the patient that we will be discussing and interviewing today is a patient who has a diagnosis of generalized anxiety disorder. And his anxiety is primarily based around needing to always finish a task, as he sees himself as a failure if he does not complete any tasks at hand. He will sometimes state, "I can't slow down, I'm always busy, and if I don't finish anything, I'm a failure." And this causes him significant worry and impairment in functioning, as he frequently stays behind at work after hours to complete tasks and is often late to social and family events due to completing daily tasks. So the 3 therapeutic modalities that we will be using with this patient in a blended strategy over 3 separate individual sessions include: first, using psychodynamic therapy, specifically exploring past experiences. Second, we will be using cognitive behavioral therapy, specifically utilizing the thinking, feeling, and behaving triangle and assigning homework. Lastly, using a solution-focused therapy, specifically asking him the miracle question. So let's go into these keywords and concepts. So past experiences is a component of psychodynamic therapy which explores past experiences which mostly occur in early childhood and how that can influence patterns of behaviors and current problems. Next, the thinking, feeling, and behaving triangle is a model used in CBT or cognitive behavioral therapy to illustrate how thoughts, emotions, and behaviors are interconnected and are influenced by each other. Next, homework is a core component of the CBT process, which aims at helping individuals practice skills that are learned in therapy and apply them to their real-life situations. This can include journaling, behavioral experiments, and cognitive restructuring. Lastly, the miracle question is a component of solution-focused therapy that uses a prompt that can help the client imagine a future where their current problems have been resolved. And it invites them to envision an ideal scenario and encourage them to think about what can be different in their lives and how they would know that the miracle had taken place. So next, let's go into a definition of each modality. So psychodynamic therapy, according to Psychology Today in 2025, it's derived from psychoanalytic therapy, which was developed by Sigmund Freud. And goals of this therapy include recognizing, acknowledging, and expressing negative and contradictory feelings and repressed emotions in therapy to help that patient understand how those repressed emotions from the past affect their current decision-making, behavior, and relationships. Next, cognitive behavioral therapy, according to the American Psychological Association in 2025, is a form of talk therapy which has several core principles, which are that psychological problems are based in part on unhelpful or faulty ways of thinking. 2, psychological problems are based in part on learned patterns of unhelpful behavior. And 3rd, that people suffering from psychological issues can learn better ways of coping with them, which can relieve their symptoms and become more effective in their lives. Lastly, solution-focused therapy, according to Psychology Today in 2025, is a short-term and goal-oriented psychotherapeutic approach that emphasizes on finding solutions to problems, such as focusing on the client's desired future goal and help identify steps to achieve that future goal. So why is each individual approach appropriate to this case? Well, psychodynamic therapy is appropriate to use initially to gain an understanding as to where this client's fear of not completing tasks derives from, such as a childhood encounter, as well as how his negative emotion could affect his current decision-making today. Next, using CBT after identifying where the negative emotion of not completing these tasks came from, using CBT can help identify the unhelpful ways of thinking, unhelpful behaviors, and seek to introduce education on coping skills or homework to help relieve the symptoms. And solution-focused therapy can be used as the last step once the unhelpful behavior and understanding has been established, and it can help the client to look to the future, help him identify a goal, and take measurable steps to help achieve that goal with a better understanding of his own behavior. So how do I expect this overall encounter to go? So I expect this overall encounter using these 3 methods to be successful in helping the client to identify where his maladaptive behavior and anxiety regarding not completing tasks originated from. Also, I want to work through the cognitive distortions related to why he feels inadequate if he does not finish the tasks. And lastly, I will have him look to the future as to what his life can look like when the problem is fixed. I will attempt to achieve these by using specific components of the various therapies, such as psychodynamic therapy, exploring past experiences by asking the patient to tell me about his life growing up related to the current problem of not completing tasks. Next, I will use CBT to work through the patient's cognitive distortion by using the thinking, feeling, and behaving triangle, and assign the patient homework to try to reduce anxiety with unfinished tasks. And lastly, I will use solution-based therapy, and I will seek to have the client identify his idealistic future by asking him the miracle question and identify at least one to help that client achieve his goals. So how do these modalities apply to cultural diversity? Well, psychodynamic therapy acknowledges the impact of cultural contexts and how the patient's behavior was shaped by understanding how cultural norms and values growing up influenced his current emotional state and self-perception. Next, CBT benefits cultural and diverse backgrounds by being adaptable and responsive to the cultural context because it can be tailored to incorporate the client's beliefs and values and develop culturally relevant coping mechanisms. Lastly, solution-focused therapy benefits cultural and diverse backgrounds by emphasizing empowerment and collaboration, and it builds on existing culturally relevant resources, which makes it adaptable to a diverse cultural background. And next, we will be moving on to our first segment. Hi, do I have your consent to record your audio in this?
Yeah, you do.
So in our previous sessions, we have been discussing your feelings and anxiety that's related to you completing certain tasks. And you mentioned feeling inadequate or like a failure if the tasks aren't completed, right?
Yeah.
So I wanted to ask if you can think of any experience from your past that might be triggering your anxiety now?
Things that from my past would probably be my parents. There was a lot of expectation on like finishing something before you move on. So like something as simple as even like finishing your food before you leave the table, or you have to finish all your homework before you take a break, or even like, you're done with your homework. It was kind of like a all or nothing thing with my parents, so maybe I inherited some of that.
Got it. So then how do you think that the past experience, like from your childhood with your parents, how is that affecting you now?
That it kind of like put an expectation for me.
Okay. Yeah, that can make sense, especially with what you went through.
Mm-hmm.
And how did these experiences shape the current beliefs about yourself?
That if I don't finish something, it's not good enough, and I'm maybe even taking too much time with it.
Okay. And how did it shape your beliefs about the world?
If you postpone something, you're lazy.
Okay, got it. And can you recall any significant childhood events or any traumas that occurred?
I was trying to complete homework, and it was really difficult for me, so I just wanted a break, and my parents wouldn't let me like not finish the homework.
Mm-hmm.
And so I kind of like stayed there basically until bedtime trying to finish the homework.
Wow. Well, I can understand why you would feel this way. Thank you for sharing.
Thanks.
Hello, it's good to see you again.
Hi, it's good to see you too.
Okay, so in our past sessions, you mentioned that feeling a sense of failure when you don't finish a task. So think back to a time where you felt like this recently, okay? So what were you thinking at the time of this situation?
Back at work last week, I was probably, it was almost like my 8 hours were pretty much done, but I hadn't completed a task, so I stayed there maybe an hour, 2 hours before I actually left, and I even clocked out and still stayed there, so that probably would be a bad thing, because one, I'm not supposed to stay there after clocking out, and it kind of just ate into my day.
Got it. And what thoughts led you to feel like you had to stay after work to finish?
Pretty anxious about just completing it in general, just like an emotional anxiousness. I thought I might forget if I leave. Maybe my manager will bring it up. And just kind of like a rumination, I guess.
Okay. And then when you're thinking back on this, what emotions are you experiencing? I know you mentioned anxiety, but any other emotions that you feel?
Just pretty anxious and stressed out about the fact.
Okay. And then how do these feelings make you want to act?
Kind of like frantic, like until I get it done. So I'm constantly thinking about whatever I need to get done until I get it done, or maybe even other things too.
Okay. So what action did you take in response to that situation?
So I mean, it'll just like pop up in my head that I gotta complete it. Otherwise, something bad will happen, or just the worst thing can it'll develop into something worse. So then I'll actually do it, and I'll as long as it takes to get it done.
Okay.
And then I kind of feel bad about it because then I'm going home 2 hours later or an hour later than I should be.
Okay. So do you think that these behaviors are helpful or are they more harmful?
My manager probably likes it, but it's definitely harmful to me.
Got it. So along this line, I want to assign you some homework to complete before our next session. And then for this homework, I want you to start a task and then not finish it. And this can be something small just to get started, but I want you to complete that and we can discuss more on how this made you feel in our next session. Hi, how are you feeling?
Hey, pretty good.
It's good to see you.
Same.
So I wanted to ask you a question and I wanted to explore this with you, okay? So suppose that tonight while you're sleeping, a miracle happens.
Okay.
And you wake up tomorrow morning and your anxiety is completely gone. So what would you notice that's different?
I probably would worry less, and I could probably just move on from things.
And how would this change help you to achieve your goals?
It'd give me probably most of my time back, so I can actually do everything in a day instead of maybe getting hung up on one or two things taking up most of my day. And then I would probably just sleep better just because I'm not worrying about the next thing. Yeah.
Got it. So can you see how you can recognize that once you eliminate or work towards eliminating your anxiety regarding completing these tasks, that leaves up more room in your life to be able to do the things that can make you happy?
Yeah, I could definitely see it.
So can you identify maybe one step that you can take to make progress towards that goal?
Well, so after doing the homework, it kind of that seemed like something that would be beneficial to keep practicing to postpone completion of tasks that I have or things or chores I'm trying to do.
Yeah.
And to probably articulate myself to people and actually say hey, I gotta move on from this, or I'm not gonna be able to complete this, instead of just worrying about other people's expectations. So a task could be, or something I can do that would help me out would be to continue with that kind of procedures.
Yeah. All right. Well, that's great. Thank you. So as you can see in those 3 previous demonstration videos, the use of not just 1, but 3 therapeutic modalities symbiotically work together over the course of several sessions to help address the patient's singular problem. Using psychodynamic therapy, CBT, and solution-focused therapy in this progression allowed the patient to identify where his maladaptive behaviors originated from, dispel the cognitive distortions, and build coping skills through education and homework, and lastly, identified a clear goal with steps to work towards to help achieve that goal. Thank you so much for watching this video.